Welcome back to Pre-Med Path. Today I want to talk about the most important factors that medical schools look at when you are going to apply. I'm going to keep this video brief and to the point. Of note is that this video is addressing factors leading up to an interview invitation. This means that interviews are kind of a separate topic that I'll be discussing in a different video. To find answers to this question of the most important factors that medical schools look at, I used a couple of different sources. I have kind of a unique background in being involved in medical school admissions, as well as being an applicant in the past. So I have a lot of personal experience with the criteria that medical schools are looking at. Because medical schools aren't all the same, I also wanted to find more broad, generalized data, and I looked to the AAMC, which pulled surveys from admissions officers at 130 different medical schools. Now let's switch over to the whiteboard to discuss further. So let's dive into it. What is the most important criteria for medical school admissions? Well, it's not too much of a shock that undergraduate GPA is the most heavily weighted factor, followed closely by the MCAT. Let's take a look at the chart from the AAMC that breaks down applicants' undergrad GPA and total MCAT score. The chart shows percentages of acceptance based on a combination of the two number ranges. You see the GPA is on the left column, and the MCAT total score range is on the top row. Now, obviously, this does not factor for the applicant's other strengths or weaknesses, but we can see a clear trend. Students between a 3.8 to 4.0 GPA scoring over a 510 have over a 75% chance of getting into medical school. On the other hand, students with a 3.2 to 3.39 GPA and a 502 to 505 on the MCAT have less than a 25% chance of admission. This probably doesn't come as a shock to anyone watching this, but let's talk about the why. Why are these criteria so often used for ranking applicants? Medical schools and the AAMC have studied trends of student success, and higher MCAT scores tend to correlate well with students successfully completing medical school. It also correlates well with students in medical school obtaining higher USMLE Step 1 scores. Why is this important? Well, a higher Step 1 score helps medical students match well, and this in general looks good for the school. Now, if you are one of those students who does not have a stellar MCAT score or GPA, please don't panic. There are many avenues to strengthen your application. Other important criteria include volunteer service, shadowing, or clinical exposure, as well as leadership positions. Of equal importance is how well your application is put together. Now, of note are the letters of recommendation and your personal statement. These are important factors that schools look at that can significantly impact your chances. I'll talk more in depth about how to maximize these factors in your favor in a later video. If you have any specific questions, feel free to comment or message me for help. I'm offering students applying this cycle individualized help with their personal statements and applications, so please take advantage of this while it's available. Thank you for checking out this video, and please hit the like button and subscribe if you want to keep up to date with upcoming content.